All right, hear me out, ladies and gentlemen. Let's be honest with each other here. We really don't want to age gracefully, do we? I know I don't. Thanks to today's modern technology, we don't have to. Dr. Thomas Kotoske, Medical Director of Cosmetic Surgery Institute, is here to tell us how one simple procedure can take years off of your face without major downtime. And along with him, one of his success stories, patient Sandy Metter. And Sandy, we're going to chat with you in just a second. First of all, good to see you again.
Good to see you too.
Okay, so it's this little procedure that you call a quick lift. What is it? And tell me what's different about it.
Well, it is a vertical plane facelift, but it's minimally invasive. We get patients back to work very quickly. Downtime, pain is very minimal. Within a week, patients are really up and moving. Swelling is down, and they're able to get back to their normal activities very quickly.
Within a week? Okay, but in a traditional facelift, it would be how long are we talking?
You know, within 6 to 8 weeks, you lose most of your swelling, your pain, and so forth. So patients make a rapid change. We're able to avoid a lot of the arteries, the nerves, and things that create issues for patients in healing. It's more of a vertical lift, meaning as gravity takes the face down, we're moving things up in a more natural position than traditional lifting.
Okay, so less downtime, major results, as I was saying earlier. Let's take a look at some before and after pictures, and how far post-op are we looking at in this after picture, which is amazing. She looks 25 years younger.
That picture right there is close to a year out.
Really?
Yes.
And she is absolutely gorgeous. And I'm sure she's not very old, but in the before picture, I mean, clearly you just took
Well, I mean, she
off.
did have a few other procedures done, and we did her nose and so forth. But this patient, for example, removed the fat via some liposculpture underneath the chin and then did our lifting procedure. But that picture is taken literally 48 hours after the original photo was taken.
No way.
Yes, she was one of the first ones that we had ever done, and she's out many years now from that time period. She looks beautiful.
She looks absolutely gorgeous. We have a different angle of her as well in the before and after picture where, look at that. And when you say the vertical, that means you're not cutting in the hairline above the eyes. This is just a small, like, from the eyes down, right?
Right, exactly. It's a geometric broken line around the ear, and then skin is elevated, the muscles moved into its appropriate position. We put retention stitches, so it lasts as long as any facelift that's on the market today. Okay,
so Sandy, you've been there, you've done that. Tell me, what was your experience like? When you a couple days later, you look in the mirror, what'd you see?
Well, actually, I was pleasantly surprised. I couldn't wait to get up in the morning because I knew I was going to look better every day. And I did. Actually, the swelling was no problem. First couple of days, I had a puffy face. Toward the end of the week, I looked really good.
Now, we're looking at some of your before and after pictures here. When you look at that before, what was it that you didn't like that you saw in the mirror?
Just the area
that
around
jowl?
here. Yes.
Oh, we all hate that, don't we?
I know. That was really my primary concern.
Yeah.
And afterwards, I was thrilled. I saw differences immediately. Even though I was swollen and a little bruised, I could still see the difference under the chin.
Most importantly, what are your girlfriends saying to you?
Oh, they think I look pretty good.
Sandy, what have you done?
Well, I've got some lined up that are already going to be going down.
All right. So basically, anybody who needs a little bit of something, it's good for this procedure, right?
Absolutely. I mean, it could be from mid-40s all the way through the 70s. We can tailor the procedure to really help anybody that has some facial issues that they'd like to address.
And you also offer really a full service. I mean, you take care of your patients afterwards. I mean, because skincare is so very important, especially after procedure.
Skincare, injectables are all part of a comprehensive program to basically give the patient the best result, and it's a long-term process. We want to keep that skin in the appropriate condition as you age, and it's the best way to do it. So we offer all those different types of things at our practice.
And you know, and I always tell you, got to put the work into it. You know, you got to take care of yourself. You get amazing results for doing it. All right, well, let me tell you about a little something special that Dr. Kotoske is doing. He's calling it Breakfast at Kotoske's, not breakfast at Tiffany's. Breakfast at Kotoske's. If you would like to host a breakfast at his office, you can just call their office. There's a 15-person minimum, and here's what'll happen. You'll do skin treatments, Botox, personal consultations, all with Dr. Kotoske. Oh yeah, and you get breakfast too. All right, Cosmetic Surgery Institute's located at 19636 North 27th Avenue. That's Suite 101 in Phoenix. 623-516-2639. You can also look them up at bodybykotosky.com.